welcome back to Night Nurse, my lovers of learning. And now we're going to talk about the final installment of fluid and electrolytes and acid-base balance, which is acid-base balance and ABG interpretation. Don't let this scare you. It's the whole purpose of Night Nurse is to try to make things that seem complicated, try to simplify them a little bit, and make them more understandable. So it's just biochemistry amongst a couple of friends. So let's talk about it. So our cellular enzymes can only function in a narrow pH. So optimal pH for cellular metabolism is 7.35 to 7.45. Cellular death occurs if it's below 6.8 or if it's above 7.8. So pretty narrow range. What is pH? It's a logarithmic calculation of the amount of acid in the blood. H plus is acid, hydrogen ion. And it's logarithmic, which means mathematically it will show up inversed. So what does that mean? It means high hydrogen ion acid gives you a low pH. So low pH is acidosis, whereas a low hydrogen ion acid concentration in the blood gives you a high pH, so it's alkalosis. So the top of the scale is alkalosis, basic, and the lower scale is acidosis. Body metabolism usually drifts towards acidosis. Whenever the body's doing something, it tends to make acidotic byproducts. And one major byproduct of cellular respiration is carbon dioxide, which is an acid. So when we remember this, this will help us. Now, is the body just going to deal with acid? No, it's going to take care of it. So what it normally does is when it has any type of acid, it puts it in a buffer. And a buffer is a way to store, transport, and get rid of acid from the body. And a huge buffer system that we have is the carbonic acid system buffer. So what happens is the normal process of metabolism, we get byproducts dumped out into the blood. So we get fatty acids, carbon dioxide, lactic acid, other types of acids, and they get bound into this carbonic acid buffer that kind of protects the rest of the tissue. But now the body has to do something about that. It has to get rid of it. It has two ways to get rid of it. It can get rid of it in the respiratory fashion by going to the lungs and expelling it in the form of carbon dioxide acid and water vapor. That's respiratory. Or it can go to the kidneys, and the kidneys can cleave this apart, actually surgically remove the hydrogen ion and dump it out into the urine and reabsorb HCO3, which is bicarbonate, which is a very powerful base. So metabolic, the renal function is much more effective. So these are the two ways that your body can compensate for acid being in the bloodstream. It's happening right now, right? Ooh, scary. It's happening right now to you. And it's all working out. So let's talk about acid-base compensation, respiratory and metabolic, what they look like so you have some terminology. So respiratory compensation, always thinking about the lungs, and you're always talking about dealing with carbon dioxide acid. It's the fastest compensation process, happens within minutes. It's not the most effective, but it happens very quickly. Respiratory response to acidosis, which would be too much acid, is to increase the respiratory rate and blow off CO2 acid and water vapor, and that will raise the pH and get it out of the acidosis realm. Perfect. Now, the respiratory response to alkalosis is to slow the respiratory rate. The body will then retain more carbon dioxide and water, and since you have carbon dioxide in the blood and it's an acid, you have more carbonic acid. So it corrects alkalosis. So it can move either way. Now, respiratory compensation disruptors make it where people can't use this mechanism are lung related because they can't blow off the CO2. Emphysema, COPD, respiratory failure, any type of lung disease. Now, the other type of compensation is metabolic, which goes through the kidneys, which is making that bicarbonate base, which is awesome. Okay, it's a slow compensation process. It takes hours to days, but it's super, super potent, like 20 times as effective as respiratory blowing off CO2. So it's slow like a turtle, but wow, is it effective. All right, so the metabolic response to acidosis is for the kidneys to cleave carbonic acid, surgically remove this hydrogen ion, kick out hydrogen ion out into the pee, but reabsorb that HCO3 bicarbonate base. super potent. It's a 2-for-1 deal. All right, it's like coupon day. But it takes time, and the kidneys have to function. The response to alkalosis is to decrease this response and not lose so much hydrogen ion, which means more of the hydrogen ion will stay in the blood. It's that simple. Disruptors of metabolic are renal related, and that can be renal disease, both acute or chronic, or it can be dehydration, because if you have dehydration, you're not moving the water wheel. You're not moving the glomerular filtration rate. You have to think of the kidney as having constant flow going through it, and that constant flow is like a water wheel that's spinning and making power. If you don't have that, the sawmill isn't going to work. All right? So remember that. If the kidney function isn't good, then your bicarbonate isn't good. So arterial blood gas terms and interpretations. Ooh, sounds scary, right? It's not. Okay, you guys are going to be fine. So compensation, remember, you have to maintain homeostasis. Changes always occur. Your body's always making these acidic byproducts. Changes occur, but the body must compensate and keep that pH between 7.35 and 7.45. If it can't, then that's called decompensation, and we'll start to see abnormal pHs, and we'll start to see blood gases that look kind of funky. So let's talk about causes and manifestations of each type of blood gas problem. So acidosis, which is pH less than 7.35, respiratory acidosis is going to be when you have too much CO2 acid. So what are causes of that? Well, it's all the lung stuff. Pneumonia, airway obstruction, asthma medications that make people slow down their breathing and they're not blowing off enough CO2, or CO2 retainers, which are the chronic respiratory diseases like COPD, which is emphysema and chronic bronchitis. Metabolic acidosis is when you don't have enough bicarbonate base, so you have a loss of bicarbonate ions. This can happen from diarrhea because a lot of our bicarb is stored in our gut. It can be from dehydration because not only are you not running the water wheel and the kidneys aren't functioning, but you also, the cells will go anaerobic on you because you're not supplying them enough oxygen. From tissue ischemia, they will go anaerobic and they will make lactic acid, which gobbles up bicarb. Bleeding, DKA, which we'll talk about, and renal disease or dehydration. Again, renal disease or dehydration, you have to think of the glomerular filtration rate of the kidney being a water wheel that turns the gears that makes everything renal work. If you have severe dehydration or you have kidney disease and you don't have a good GFR, glomerular filtration rate, and that water wheel isn't turning, then everything the kidney does shuts down. Acidosis effects. What do we see with acidosis? Acidosis makes people sleepy, CNS depression, and then headache, confusion, lethargy, coma, death, drowsiness, and depression. Okay? Also causes hyperkalemia, which could be on that slide. But compensation is to increase the respirations and blow off the CO2 or get the kidneys functioning better. Alkalosis, which is a pH greater than 7.45, it's respiratory alkalosis is going to be when you've blown off too much CO2 acid. Remember, respiratory always has to do with CO2, and CO2 is an acid. So respiratory alkalosis is a loss of too much CO2. How can that happen? Well, someone's anxious, they have a fever, they have an aspirin overdose, some sort of brain injury, some sort of thyroid storm or something like that, manic disorders, and they hyperventilate and they blow off too much CO2. Now, metabolic alkalosis can occur when someone has too much bicarb. This is not very common in normal situations unless we sort of cause it. But there are a couple of cases it can happen. Early vomiting and NG suctioning. You are removing hydrochloric acid, which is H plus Cl. So early vomiting and nasogastric suctioning, a tube in the stomach that constantly sucks out the gastric secretions, you're removing hydrogen ion, which means they're going to have excess bicarb. So that can cause metabolic alkalosis. Now, if they keep vomiting or you dehydrate them out, they switch over to acidosis because now they're dehydrated. But early on in vomiting, just losing the H+, you can give them a balance of too much bicarb, which is metabolic alkalosis. It can be iatrogenic because you overcorrect for acidosis. Someone comes in acidosis and you overcorrect it. Alkalosis effects are CNS irritability, muscle twitching, tingling, restlessness, numbness of fingers, and seizures. They're all kind of buzzing with alkalosis, whereas the acidosis was CNS depression. Now, disruptors of alkalosis is decreased respirations, compensation is to decrease respirations that will increase your CO2 or to excrete bicarbonate through the kidneys. Okay, so those are just some basic understandings. When you hear respiratory, you think CO2, and you know CO2 is an acid. When you hear metabolic, you think bicarbonate, and bicarbonate is a base. Now, knowing that, you can do blood gas interpretations. Wow, just like the big boys and girls. All right, so what is normal in a blood gas? Well, you have pH, which is 7.35 to 7.45. We already talked about that. A high pH is alkalosis, and a low pH is acidosis. We already know that. CO2, which is measured in a blood gas as partial pressure. Okay, so you get a P in front of it. PCO2, the normal is 35 to 45. It's an acid, so if CO2 is high, you have acidosis. If it's low, you have alkalosis. CO2 is always respiratory. Bicarbonate, which is always basic, its normal is 22 to 26. It's a base, so if bicarb is high, you have alkalosis. If bicarbonate is low, you have acidosis. Remember, it's always metabolic. SpO2 is not needed for a blood gas. You can use it for diagnostics and things like that, but you only need a pH, CO2, bicarbonate, and you want to know those values automatically, and you will be fine. So let's use the night nurse method of ABG interpretation. It'll never fail you, okay? I'm an NP, I've worked critical care, I've worked nursing supervisor, I've worked ER. This has never failed me, and I've been a nurse for over 20 years. Okay, I've been an NP for almost 17 years. So I'm old, and this still works for me, so trust it, okay? Step 1, you identify your pH, PCO2, and bicarb. So pH, evaluate each number separately in this order. pH, is it normal? Is it acidosis, which would be low? Is it alkalosis, which would be high? And you mark that down next to it. And we'll do some examples. PCO2, you can automatically write the word respiratory in because you know it's a respiratory gas. If it's high, then it's acidosis because CO2 is an acid. If it's low, then that's respiratory alkalosis. And if it's normal, it's normal. Bicarbonate, it's always metabolic because it's renal metabolic. If it's a base, so if the bicarb is low, then it's metabolic acidosis. If it's high, it's metabolic alkalosis. Or if it's normal, you write it down. Okay, so you just get those 3 numbers hard and fast. And then you do step 2. If the pH is abnormal, then let's start matching the pH with any matching values, either the CO2 or the bicarb. Okay, I call this the Who's Your Daddy. You have to match the last names. The condition that matches the pH is the primary abnormality. Now, sometimes you'll have a third step, which is to check for compensation. If the other value that isn't the first cause is abnormal, then it may be compensating. Okay, so if the pH, especially if it's opposite, so one will be acidosis, one will be alkalosis, and so one is the primary problem, the other one is trying to correct the primary problem. It's trying to compensate. And sometimes the pH is completely returned to normal, and you have abnormal PCO2 and bicarb, and it's completely compensated. So if the other value that isn't the primary is abnormal, then you have compensation. If it's not abnormal, you have no compensation. Okay? And we'll talk about partially compensated and completely compensated. And completely compensated is probably the toughest for people because you have to use what I call the night nurse lean rule. So let's show you some examples using this method because it seems kind of abstract when we just talk about it, doesn't it? So let's talk about one. So here's an example. We're going to use our process. Okay, so what is the pH? 7.41, normal 7.35 to 7.45. So that pH is normal, we just write normal. PCO2, we can automatically write respiratory. CO2 is supposed to be 35 to 45. CO2 is normal. Bicarbonate, we know it's metabolic. Normal is 22 to 26. So bicarbonate metabolic is normal. So this is a normal blood gas. Woo! Wow. Got that one out of the way, right? But you use that same process and it just gets a little trickier sometimes. So let's talk about the second one. All right, pH is 7.26, normal 7.35 to 7.45. So this pH is low. Low pH is acidosis. All right, so we know it's going to be called, we know that it's going to be some sort of acidosis. We don't know who caused it though. So CO2, 51, CO2 is supposed to be 35 to 45. So this CO2 is high. And CO2 is an acid, so this is respiratory acidosis because you have high acid. Okay, bicarbonate, 22 to 26 is the normal. It's a base, metabolic. Well, that's normal. So there you go. All right. So do we have something abnormal? Yes, the pH is at. So yes, the pH is abnormal. So you can see I'm starting to make the name acidosis. Okay, so we know that's its last name. Okay. So who's daddy? Okay, we got to find out what matches it. Does something match the pH acidosis? Yes, respiratory does. So we know it's respiratory acidosis. Is the other component abnormal? No, the bicarbonate is normal. If it were acidosis, it'd be both. It'd be combined, respiratory and metabolic. But it's not. Bicarb is normal, so it's uncompensated respiratory acidosis. All right, ready to get a little trickier? Let's get a little trickier. So pH, 7.53, supposed to be 7.35 to 7.45. So this pH is high. High pH is alkalosis. So CO2 is supposed to be 35 to 45. This CO2 is high. CO2 is a respiratory acid. So high acid means respiratory acidosis. Bicarbonate is supposed to be 22 to 26. This bicarbonate is high. Bicarbonate is a metabolic base. We have high base, metabolic alkalosis. Okay, so is anything abnormal? Is pH wrong? Yes, it's alkalosis. Uh-oh. Okay, well, which one caused it? Well, match the names. Who's your daddy? The alkalosis caused it. So since bicarbonate matches it, then we go with metabolic alkalosis. Now, the other component is abnormal. Respiratory is abnormal and in the acidosis side. So that is the beginning of compensation. Is the other component abnormal? Yes. CO2, acidosis, compensating. All right, so we know it's compensated metabolic acidosis, but how compensated is it? Okay? Is the pH normal? Compensation, when it's complete, it has completely restored you to homeostasis. It has restored balance to the force, and pH is normal. This pH is not normal. So if this pH is not normal, it's only partly done, so we have partially compensated metabolic alkalosis. So you build the name from the right to the left, and you end up with what you need. Pretty soon you'll do this and you won't even write them down. All right, let's do the trickiest one. All right, so pH, 7.37. pH is supposed to be 7.35, 7.45. So that pH is normal. Okay, but we don't stop. We always do the first three steps. So CO2, 57, normal is 35 to 45. So our respiratory acid CO2 is high. So this is respiratory acidosis. Bicarbonate is supposed to be 22 to 26. Our metabolic bicarbonate base is high. If we have high base, that's metabolic alkalosis. Okay, so, is anything abnormal? Yes, we usually use the pH to name it. And the problem here is our pH is normal. So we know CO2 is moving in the acidosis. We have high CO2 acid. And we know bicarb is high bicarb. So something messed up and the other thing fixed it. Right? So what are we supposed to do with that? Well, this is where you can use the lean rule. We have to find out which problem came first. That's how we name it. So how we do that is we use the 7.40 night-nurse lean rule. All right, our normal blood gas is 7.35 to 7.45. So the middle of that is 7.4. And the pH, the body will never do more work than it has to. So the pH will lean towards the primary problem. So as soon as the body compensates enough to get into the normal pH range, it will stop. So the pH lean rule, the Knighter's lean rule, will let you see that the pH is leaning towards the first problem, even though it's worked to get the pH right. Okay? So 7.37 leans towards acidosis, doesn't it? It's below 7.4. So acidosis is the primary problem, and in this example, CO2, respiratory acidosis, is the acidosis. So this is respiratory acidosis, right? Now, is it compensated? Yes, because bicarbonate is opposite and it's moving in the other direction. So we know it's compensated, and it's completely compensated because the pH is normal. Okay? So those are the trickiest ways you can do blood gases. Rewatch this as many times as you want, and you're going to see that it doesn't change. I can mix the numbers all I want, and that process works every time. In fact, I'm going to give you some samples here. So you might want to pause the video, write these down, and give them a shot. Because in 5 seconds, I'm going to show you the answers at the bottom. So 5, 4. Okay, here are the answers. All right. So hopefully that's what you found they are. So hopefully you found that to make blood gases a little bit more human and a little bit more understandable. And so that concludes ABGs, and I hope you found it helpful. If you did, please be sure to subscribe to the Night Nurse Learning channel by clicking the link. And you can always find more information at nightnurse.com. I'm always trying to build new videos to help you understand these concepts. So thank you for listening, and I'll see you next time.